of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Welcome, everybody. I will take the roll call. Jenna Dykett.
Present.
Timothy West.
Present.
Ray Luber. Present. Joe Petrosky.
Here.
I am also here. Amelie can't be here today. She had a prior engagement. Any adjustments to the agenda?
I don't know. I don't know how to answer that question.
I don't think so.
No, well, but from the agenda that you guys were presented tonight, but I would say, probably should say yes
Yeah, to 5.2.
to 5.2, yeah.
Oh, okay. Just filling in the name.
Well, I think we need, I don't think on the agenda that was sent out to the public that was on
That was
there.
on there.
Oh, it wasn't. It
I
wasn't.
don't know.
So I'm gonna put it as, it can't hurt. I'm gonna add it
Okay.
as a adjustment. So it's 5.2, it's a nomination of a teacher for the special ed position at the high school.
All right. I will entertain a motion to approve the minutes of the Winthrop School Committee meeting of September 1st, 2021, as written or with corrections.
So moved.
Second.
I just did that intentionally.
Moved and seconded, discussion. Seeing none, I'll call the vote. All those in favor? Passes unanimously. Superintendent report.
I sent that out before in your packet. I also wanted to share that today, and I'm not gonna spend a lot of time on it because it'll come up later on. But I did get around to the grade school. We had an early release today. Got around to the PLCs that were happening at the grade school. Just to kind of talk to them because obviously things have been a little bit wild at the grade school. A lot of stuff happening, so I just wanted to touch base with the teachers, and it was really great. Not that I need to convince any of you of how amazing that staff is, but it was they're awesome. I think they're weary. They are focused. They are on it. But I hope that something changes fairly soon because I don't know how long. And as I met with Marsha and Teresa before this meeting, and we don't meet again for 3 weeks, but I would say that if something doesn't wane, and not just the grade school, if something doesn't wane in the next 2 or 3 weeks, we're gonna have to think about what that means. I think it's a huge burden, what's going on now. So, I didn't make any other notes for myself, so unless you have any questions on my report, I'm good. Do have one appointment, and that is Tegan Newhall. She's a special ed Tech 3 at the high school.
I just had one question.
Sure.
You mentioned in your report that you had reached out to both Hassenfuss and Hickman, but that you only met with Hassenfuss. Did you hear back from Hickman and your schedules just didn't work, or you didn't hear back?
No, I heard back. Let's just say I've heard back. I basically reached out and to solicit support. I felt like I got it in one place and not in the other. So.
I had a quick question. You had mentioned we're getting closer to filling our vacancies, and with the 2 that are on the agenda tonight, what's left?
But the ones that, if we fill the ones that are on the agenda tonight, those are our regular vacancies. What will still be available are positions that are part of our ESSA grant. We have some more COVID instructors that we'd like to find. What's not specifically part of our ESSA grant, but it will be, is ideally we'd like to find 3 or 4 people that, assuming that we go forward pool testing, to assist with pool testing, so to assist Jeannie and Melissa in doing pool testing. That's it.
Oh, we still need a librarian.
Oh, yeah.
And the text.
A what?
And text. 2 ed text.
I thought we filled all those.
Nope.
No? 2 ed techs? Well, That's why we bring those guys here.
That's right. Okay, that's my only question. Anybody else have a question for the superintendent?
Should we be waiting to ask questions about COVID and what's going on in the school when the nurses talk and stuff?
I think we
didn't know
did.
we were talking about.
That's that part of the agenda.
I'm happy to answer questions.
I mean, I'm okay.
Well, that's on the agenda.
Under old business,
I'll
we're
do it.
gonna revisit the school protocol. Would that be the best
Yeah.
time, you think?
Yep, that'd be
Okay.
fine with me.
All right. Anything else for
I just,
superintendent?
yeah, well, I have another, I don't know if we need to do anything about this, but, or if it's just something between the town and whatever, but doing the November elections and all elections at the high school from now on, I get with what's going on in this room right now, trying to do an election here might be an issue because of the impact on the grade school, but I do also worry about impacting the high school over and over with elections as well.
Yeah, I don't think we intended to say that will be forever.
Okay,
I think it's-
okay, that's fine, I just wanted to sort of clarify that, sort of, and I get that this might just be a COVID thing until they have room to do it, but I would just want to make sure that that wasn't sort of a permanent thing.
Right.
Okay.
Good question, Jana. Okay, anything else for the superintendent? You look like you have a question.
Well, no, I was just, trying to problem solve that a little bit really quickly, and could we make that be the day of caring?
It happens. Oh, you can.
Oh, no, I'm sorry, I'm thinking of the wrong day. No, I'm sorry, October 13th is gonna be split. Half my school is gonna be do dare caring and the other half's gonna be testing. My teachers are just planning on doing remote instruction during those days, as we do on snow days.
Gotcha.
Okay. All right, so nothing else for you? You're done, right?
Okay.
Okay, moving on to me. I just wanted to remind the committee that there is an upcoming MSMA fall conference that's gonna be virtual. I did check yesterday, and I had Colleen check too, and we have not seen anything yet for registration, but it is the end of October, so I would assume that that would be coming out soon. If anybody is interested in attending, let me know. Okay?
I have a little bit of an update. I did do the program the other night with Region 8,
Okay.
and that's where basically they discussed the resolutions and everything.
Mm-hmm.
They're really going through, almost any region that wants to meet is going through the same thing, and then they're redoing them again. And that may be one reason why there's a little bit of delay, because I think they found some significant changes that a lot of people want to see in the resolutions.
Oh.
And I'll give you one example. I can't remember if it's one or two, but I think it's one. It's an endorsement basically talking about what we think needs to be done at this time and what every school should be doing. But in this, it talks about students in school. It talks about taking care of those who have to miss school. And then it also talks specifically about every school should be prepared to teach remote. And the objection is not to not wanting to teach remote. The objection is to say, this is an added expense. And that if you've got a way of somebody paying for it and preparing for it, that's different than just telling the schools that you have got to have a remote program already in place. And so overwhelmingly, the people said, we think the last category, I think, is other activities in terms of how to teach and how to approach students. Why not just put it there as part of that group, rather than singling it out as a completely separate area? So I don't know what's going to happen with that resolution, but I do know that the executive director was a little bit surprised with the negativity that he received on that one. I can't remember if there's 8 or 9 resolutions, but let me just say that the first hour and a half was basically spent on the first two.
Wow.
And then they said they had promised everybody would go home at 7:30. We're not the only ones, I found out, we're not the only region that's a real problem, so
Yeah.
we'll see what happens.
So my question to you is that, so then if they're making these significant changes, will we have to relook at them to,
Well, I think that's
At the
one
end of
reason
that-
why they don't want us to look at them right now, but to wait to see what the final send-out will be. And I think I may have asked that question, I think that's what they said, so. But we have time to do it, we've still got, an October meeting. The other thing that's kind of worrisome is, I gotta find out for sure, but somebody mentioned that this virtual delegation meeting, okay, is actually gonna be held on Saturday the 30th. I go, no, we've only got the 28th and 29th down in the calendar.
I thought it was the 23rd of October,
I've
the
got,
delegation was.
I've got 28 and 29. And who knows, maybe I'm wrong, but that's what I've got. See, last year,
Because I remember it was
you
on.
may have remembered that we spent basically close to 8 hours
Yeah.
on the resolutions last year.
Oh, my goodness.
And so that was the other thing, the reason I think for going through all of this was to get it closer to what it should be, or what people do want it to be, rather than doing all of that in one day.
That makes sense.
So anyway, I wouldn't panic about it, they'll get to it.
Okay.
You will panic about it, or you
No,
don't?
I can't
I was
about
gonna say,
I say no.
All right, second thing I wanted to talk to you guys about was, I don't know if you remember, we talked a while ago about doing a board self-evaluation. And we talked about doing it in October, which is next month. So I have a tool here I'm gonna hand out to everybody. I chose this one, I got it from Ginny Geyer, and I chose it because it breaks it out if you look through it. The first part is more about us as a board and a governing body, and then the second part is about the actual meetings. So I liked that it was separate, and you can kind of focus a little bit more. The second part suggests filling it out after a specific meeting, a specific school committee meeting. So I don't know how you feel about it, if you want to do this part after this meeting, or if you would feel more comfortable to look at this first and then do it after the October 6th meeting. It doesn't matter to me, but I thought we'd kind of nail that down.
I'd like a chance to just look at it. before
Okay.
I-
That's fine, how do you guys feel about that?
Yeah,
Yeah,
that's fine.
okay. So, if I could have you guys do that after the October 6th meeting, and then, take a look at the rest of it, and you can fill that out too, and then maybe at the October 6th meeting, we can think about how much time you think you'll need to hand it in, and pick a date. In our policy, it says that we will do this at a special meeting with nothing else on the agenda that day. And so we'll have to look at a date, we'll have to pick a date for that, so be thinking about that. And I just want to throw it out there selfishly, if maybe it doesn't have to be on a Wednesday, because I think there's going to be some playoff games on Wednesdays at the end of October. That my girls hopefully will be in, so, but if I have to miss it, I will, but. So there's that. And then lastly, Jana, Jim, and I met with the A-team last week, and Jeannie was there too, and we talked about all the quarantining, and there's been an ongoing conversation about exploring ways to get the kids back sooner. And as you know, Jim and I met with Tavis Hassenfris the other day, and he was very open to listening to us, and he's already done a whole bunch of research, and I believe he's coming today, if he can, around 7. His daughter had a dance thing. But, so he'll be here if anybody wants to speak to him at that time. And that's all I have. Any questions? No? Okay. So we can move on to the committee reports. Finance.
Nothing new to report, but, I do want, and Sue and I were talking that it's been Kelly and I for a while. It'll continue to be Kelly and I until at least December. I don't know if we want to maybe even just do a little training just in case you might have to fill in. I don't know if you want to fill in. I don't know if Joe wants to come in, but there's gonna be a hole in that in January, so. I know, sorry, but I'd rather
It doesn't
think
have to
ahead
be a
now,
Jana.
to do that, even if Tim wants to come and just get trained and see what it looks like to do warrants or whatever else, but.
Emergency.
Yeah, but we will have to think about that. And
Yeah, whether it's whoever takes your place or one of you, yeah, because Jen is up for reelection or not this year.
So just everybody be thinking about that. Anything else, Jenna?
Nope, nothing new to report on for those yet.
All right, for policy, we met today, and we went over IJNDDR, which is an Apple iBook sign out, and also the exhibit, which is the actual, one was the guidelines and one was the actual form that you sign, the
Correct.
parent sign. And then also JL, which is school wellness, and those are, we'll be talking about those at the October 6th meeting for first reading. And that's all we have for policy, although we are gonna actually start looking at section I of the policy manual and making a plan for what policies we'll be looking at next. Negotiations.
It looks like we're gonna be looking at the support staff contract next, so it'll be out to committee for review soonish.
Okay. Thank you. And curriculum.
Yes, so I'm happy to update you guys on some of the work that had happened previous to this year. I've included it in my administrator's reports, but I wanted to make sure that it was out there for those who maybe log in differently to get those notes and update you on some of the work that we've already started this year. So last year, even though we were knee-deep in COVID, I'm very proud to say that we developed really a pre-K-12 math team to start looking at mapping out our math standards from pre-K through 12 for our math courses. K-5, pre-K has kind of their own little niche in what their standards look like, so it works a little bit differently. But K-5 has levels of proficiency aligned to each of the MLRs for math and when it happens in their curriculum. So they've actually paced out each trimester with which topics, which is what they call a unit in math, in their math Envision 2.0. So they've done all of that work previously in their PLC group. So we had a teacher leader at each of those grade levels who facilitated that work after meeting at the district level with me. Our middle school folks, because they teach multiple grade levels, did not complete that work, along with our high school, which there's a lot of math courses that we offer, especially once you get to your senior level math classes. There's a lot of different directions you can do that are a little bit more specialized. So that was some of the stuff that we did last year. We have not convened yet as a group. But this year, I actually was invited into the high school, and we did some curriculum work across all of the disciplines today, taking a look at the updated MLRs. And again, even through COVID, the state has done some of their own revisions. So in 2019, we had some changes to science. In 2020, we had some changes to English language arts. And so they've been going through revision, so it was a great opportunity to have all of those teacher groups sit collaboratively 9-12 with their content area and start looking at what standards happen when and at what level of proficiency we expect from our students. So we did some vertical alignment today, but we didn't really do any of the digging in per class. That's more independent, and I think some of the best work happens when you have an opportunity to collaborate with your peers. And so that's really what today was focused on, was collaborating 9-12 in content areas. And I think it went really well. I got some great feedback from the staff, and they're excited to be digging in and creating and having those discussions this year. So they're really excited, actually, I'd say. Even with everything else going on, they're excited to be doing this work and having those conversations. So yeah, excited about what that will hold at the high school level. I've already talked to Ms. Pilot a little bit about what that will look like at the middle school, and we'll be working on that, I think, in October. And so we're gonna work 6-12 right now, and then when we're able to, we'll either pick up the math group and do a little bit more pieces with math, or we might expand it into another content area, but we really need to see what's best for that building. It'll be a little different than 6-12.
Great, thank you so much. So for the administrators' reports, they were sent in the packet. I was going to say I thought they were particularly great this time. I was very excited when I read everybody's. You guys are just doing amazing things.
I'd echo that too. I thought this was
Really well done.
really
Any questions for any of the administrators? I had a couple. Mr. Campbell mentioned an advisory block that he and Mrs. White have been working on, and I would love to hear more about that because that sounded fabulous.
Tag them, yep.
I don't mind talking about it too, Mr. Campbell.
So I was involved with the seniors, so I would let you talk to the other 3 classes. Ms. Boulette and I met with the seniors, and we went through the information that guidance is going to need in order to be able to help them with completing the Common App and writing essays, deadlines, things like that. So that was well received by the students. And then when that was done, we sent them back to their homerooms to review their transcript again, even though we had done it in the spring, just to make sure they had actually got the classes into the schedule they need in order to be on track for graduation in June.
That's fabulous.
So I'll tell you a little bit about what we did in this first advisory block, and then a little bit about the history for those of you that aren't familiar with what the advisory block is going to be. So the freshmen and sophomore groups did the same activities. They did a time management and time organization activity, which was a very kinesthetic. First, what they were asked, what does a minute feel like? And they then discussed why do some minutes feel longer or shorter. And then we had them make paper airplanes 4 different times under 4 different constraints to talk about when did you feel the most stressed, when did you feel the most prepared. I'd be happy to share. It's a pretty fun activity. And time management was a skill that both our student leadership team and our teacher leadership team identified as something that our younger students at the high school level could work on. So kind of how can we have an engaging conversation about some of these soft skills that our students need. Our juniors did a course audit for their freshman and sophomore year where they took a look at what have they taken. And then they filled out a draft of what I hope my brag sheet will look like. And the brag sheet is something that they essentially use to brag about themselves when they're senior. It's part of the senior stuff. So like a visioning, and then they created a group vision board for 2, 5, and 10 years in the future with magazines. So the intent of advisory block, and it's gone through a lot of iterations over the years, is it's a time to create community at the high school with the group that you're with for 4 years. And so some of the feedback that we had gotten from teachers, or that Mr. Campbell had gotten from teachers, is that if we're going to have this time back, which they wanted with their kids, it's really helpful to have a structured activity, and that it starts hitting some of these other pieces. And some of those other pieces are guidance, life and career readiness standards. So that's where I kind of got looped into it, is how can we take these standards, take the guiding principles from the high school, and come up with activities that are going to be engaging, that are going to build community, and that are going to help strengthen some of those other non-traditional high school pieces for our students. And we're very excited after our nomination this evening to have a new member who will help guide some of that work at the high school level, our high school guidance counselor, where this will be almost her curriculum piece to really take some steps in the direction of the needs she sees for our students and the knowledge that she brings to the table. So super excited about the work, because it will be work, developing some of that this year. Psych.
How often will it occur?
Once a month.
Once a month? Wow, that's fabulous.
Yep.
That's great. I loved it. The only other question I had was, Megan, can you explain a little bit more about, because you spoke about the American Rescue Plan, the ESSER funds, and the CIS teachers and the ed techs. Can you explain again what those roles will be? In particular, I know some people are concerned about when the kids are out on quarantine, what's happening, things like that, and how that all ties together.
Yep.
Or if it does.
So when you hear CIS teacher, it can kind of be interpreted as two different things. We've hired 3.5 folks to be CIS teachers. One of them is specifically at the grade school. We have a math CIS teacher who goes 3-8 and specializes in math. And then we have another person at the middle school with ELA. And then we have a half-time kind of jack of all trades at the high school. And the intent of those certified teachers is that they're providing direct instruction. I call it high impact tutoring to small groups of students that are identified by the regular classroom teachers. So we're building those structures currently right now on how do we do these referrals, how can we use data to drive all of these decisions. So part of the math piece is they're going to be doing a pre-assessment about a month ahead of time before a unit starts, if we're talking K-8. And then they'll identify maybe, I think we talked about it being a small percent of students at each grade level that need targeted instruction on a specific prerequisite skill. They will go to the CIS math folks, whether it's a person working K2 or a person working 3-8, and they'll provide support for that student on that specific standard. So that as the classroom teacher moves into that instruction on the new skills, they've already had the support for the prereqs that were identified as a weakness prior to starting that unit. So we're not being reactive. We have a plan to be proactive to identify those gaps before the unit happens and provide instruction that will then allow them to move at the same level with their current classmates. So it's not about remediation, it's about support before you need it. The ELA piece is going to maybe work a little bit differently, and there's already some structures in place at the grade school for progress monitoring. So let's use the data we collect to identify students and use that as a way to monitor their growth also. So very excited about those two things. Those are our CIS teachers. So you can see all those things are great things, and they will take up a whole day and then some for these folks. So we do have, 3 CIS ed techs. One of those has been hired at the grade school, and 2 are still vacancies, one at the middle school, one at the high school. And these folks are meant to help more with filling in some of those empty pieces that the building will need as an impact of COVID. So not necessarily related to the quarantining piece, but more related to the day-to-day operation of the building.
Okay.
I think, and I think that maybe our building administrators could speak a little more to this if we need to. The quarantining piece is really a building by building plan. We really have kind of grasped onto Mr. Hodgkin's mantra of 3 buildings but 1 district. But when it comes to what students are able to do independently, it really varies from building to building. And so honestly, some of those quarantine opportunities, because I think they're really opportunities versus expectations, those have to vary building to building. So I think that's a little bit more specific to what the building guidance is.
Okay, thank you. All right, one more question. I'm moving on to Joel. Joel, in your report, you mentioned wanting to have a discussion about vans for some of the smaller groups. I guess my question was, I know we have 1 new van, correct, that's directed to special ed. Is that something that is available to the teams after hours, or do we need to be looking at another van? How does that?
In the past, I don't think it has been because it's been bought with special ed funds. So not that Sue wouldn't work with us or anything, it's just that because it was purchased, I think it crosses lines as far as funding for what, so we don't want to lose funding by using it for something else.
Sure.
It's still our intent though to buy at least 1, we had talked about 2 vans for
Yep.
regular ed
And I think Janet could probably speak to that. We've been talking about this for about 4 or 5 years, just
Yeah.
because it's not only helpful, it financially makes sense, but you know, we're very fortunate that we have Northeast right now, but if we didn't, I don't know. I was talking to the AD from Oak Hill today, when they have an away football game, they're gonna make 3 or 4 runs to Lisbon to get the whole team there, because they can't get a bus. So I think it's important to be proactive.
Yeah.
Joel is correct that we're fortunate because we have that agreement with Northeast Charter, but I think the vans become a really critical piece because Sue could probably tell you more than I can, that what she's paying from the special ed for essentially private transportation for special ed, and what we pay to take small groups of students on these trips, we could do with our vans and our coaches or some of our people. and we would not incur the cost is astronomical. I'm very confident that in a matter of 2 or 3 years, we will save the money that we're paying to Northeast Charter for those. Now, you know, we can't obviously transport our entire student population, but we certainly can do our small runs, small teams, small clubs, special ed, and save those costs.
I know before the availability of vans was scarce.
Yeah, I think
How is it now?
Yeah, I haven't looked at it, obviously, been a little busy
Yeah.
since school started. I think it's much more available now.
Oh,
The place where, well, unfortunately, because I was looking at, the owner passed away about 6 weeks ago. But he wasn't really running anywhere, but they basically said to come back in the fall because they have a big business with camps and,
Oh, camps, that's
Oh,
what
Yeah.
it was.
yes.
so once the summer season was over, which it is now, they would say they should find some that are available.
Oh, great.
Yeah, but it's not gonna be cheap.
Nothing in. And then also, I just wanted to echo in your report, you had pointed out everything that George, Troy, and John were doing, and I just wanted to publicly say thank you to them for all their hard work.
Yep, absolutely. I would pass that on.
Anything else? I kind of dominated that. Anybody else have anything? No? All right, we will move on to old business then, which is to revisit the return to school protocol.
Well, do you know where you want to go with this discussion?
No, go ahead. Take us anywhere.
He was just concerned where would I put this comment, that was all.
Yeah, that's true. Well, you know, basically, I just, can I go back to Joel first?
Yes, of course.
So at this point, we're not having a problem with transportation of our teams?
Not at all.
Because I am hearing also from other sources that it's...
Yep. No, Larry's pretty clear about days. I have a max of 4 trips that I can go out, and that's very reasonable for 6-12 athletics. So yeah, nothing yet, but if there is 4 days already on the books, like today, he just told me the days ahead of time that he couldn't cover it just because we already have 4 teams going somewhere. So yeah, no, we're good. So.
That was one of the things that I wanted to bring up, because I just heard it's all over the state and everything.
Yeah.
My other question is related to somewhat to the concern that has been expressed already about the quarantining of those in close contact. And part of my understanding, and I was trying to talk with Jeannie a little bit on the way in here, was the fact that where are we with the contact testing or the pool testing and everything? Is it, if we're not doing it, is it our fault or is it the state's fault? What's going on? Because I do read that.
You're asking 2 different questions.
I know I am that. But so I'm just kind of getting a fixture on this thing, because my understanding has been that if we have pool testing, that this can affect how many people have to actually be quarantined.
We haven't been approved for pool testing. We haven't started pool testing yet because there's a process to go through that includes training and then notifying our parents, giving them an opportunity to opt in. One of the interesting things I've heard is people saying they were opposed to pool testing, and my answer is simply don't sign up. If you don't want pool testing, don't sign up. But Jeannie, I hate to put you on the spot, but I heard enough of your message but I couldn't understand it. It seemed very intriguing to me. So do you mind? Because I think it's relevant. If not, we can wait later.
I listened to the 3 p.m. Dr. Shah update, and the bottom line of this is the DOE. There's a lot of conflicting. There's the main CDC recs, and then the U.S. CDC makes some recommendations, and then the DOE sort of makes some recommendations. So it's been very challenging to try to maneuver through pretty much 3 separate silos at times of recommendations and mandates. And the pool testing has been recommended, but today, just out of the blue at the 3 o'clock, televised update from the CDC, Dr. Shaw was asked a question about quarantining, and I'm driving, I probably could have gone off the road, but he answered the question of, well, if there's a positive in a classroom and everybody in the school is participating in mandatory masking, then no one in that classroom has to quarantine, which is, right, Kim, and I went, whoa, like,
Yeah.
right, so that is totally different. You know, it didn't talk about 3 feet, 6 feet. That was very different than what any of us are doing, any of the schools are doing. I got home, hopped on the 3 o'clock Zoom for the school nurse consultant, the whole, and put that DOE and put that in the chat saying, and I was just told, well, we haven't heard that, and Jeannie, we're gonna move on. So I can't get, I've tried 2 weeks in a row to kind of get a yes, no answer, and then today was intriguing that he's, again, I don't know if that's, I do not think that's what the DOE is saying, but then I put a call into this afternoon to the CDC infectious disease and said, like, can I please get somebody to give us some answers, or someone to meet those 3 groups, just can they meet together and just come up with one message for the schools, because all of us here are getting slammed in different areas, and you know, just when I think I have a path to go on, I get thrown a curveball, and this time from, you know, something that's televised too, so if I was a parent listening to that, I'd be having some questions about why, you know, here I am, you know, so I don't know, but I was calling you, Jim, because I was like, what, because I thought maybe I misheard it, I don't think I did.
She called me and goes, did you hear this? I'm like, no.
But again, I think I don't know if that's right or wrong, but to me, it just accentuates the message is so muddy right now with all of us, and especially the schools. We're really getting that, you know, but pool testing, yes, we're signed up, but again, it's another one of those things when you listen to Pender Macon and the commissioner say how it's so easy and it's seamless. That is not the case, and we're getting a lot of feedback from other school nurses. Their pools are being lost, you know, pickups aren't happening, the people that the company has hired to help us don't show up to the job. So I mean, this is not going to be this magic bullet that we're undertaking with pool testing. I think it will help in some, especially elementary school, but kids who are vaccinated in high school, middle school, I mean, you know, I'm not negative against it. I really wish we weren't going to do it, but we've been tasked to do it. We're going to do it, but I would just caution you that this isn't going to make things perfect by any stretch.
From my perspective, I'm going to pick up there. For me, it actually adds to the confusion, and it's why originally, if you remember, school committee remember that Melissa and Jeannie and I were not in favor of pool testing, and it wasn't our recommendation from the administrative team coming out of administrative retreat. And this is primarily the reason why I'm going to use my, well, let me turn it over so I don't give away some of my other notes. But this, you probably won't see this. I don't know, Tiff, if you can get it on there. But basically, this is the practice we're doing now. And if I'm wrong, Melissa, Jeannie, please correct me. But this is what we kind of had said, that if the student in the middle here were tested positive, then the students within 3 feet, masked or unmasked, the way it is right now, would essentially be close contact. I was really kind of okay with that. Is that right? Am I saying that correctly?
That's what we're doing.
Yeah, okay. So I share that with you because now those people are supposed to quarantine for 10 days. However, if they're in the pool testing, if these 4 are in the pool testing, they don't have to quarantine at all, or they can test out. What I've been trying to get clarification on is why the difference. If we have parents that are asking me, and I can't give, and I look stupid because I can't give them a good answer. They're like, why can't I take my kid, get them a test, a PCR, and have them test negative, and then let them come back to school? And I said, because we're being told we can't. But then I'm hearing the same thing. I contacted Emily Poland, who's the, you know, you guys know who she is. And, you know, she's the sort of person who's going to make the final decisions on these things, whether she wants to or not. And she really can't give a clear answer on that. She's like, well, no, that's just the way it is. If they're not pool testing, they have to quarantine. Is there any way to get those guys back in earlier?
Then, this came up, this is actually language from the CDC, which wasn't adopted by the DOE, which adds to the frustration. It basically outlines a protocol for students who are determined to be close contacts, can test back in after 5 days being asymptomatic with a negative PCR. The schools did, DOE hasn't adopted that. So all of this is really frustrating, and it creates a lot of confusion, and it creates inconsistency, and it makes schools, you know, now the DOE and we're leaving it 100% the school committees make this decision. So I had a pretty in-depth conversation with a DOE member, and the person basically said, you need to know this reality. Nobody's going to answer your questions. It's politicized. It's not going to, you're not going to get answers. So at the end of the day, the reason that the DOE and the CDC are saying these are all guidelines is because nobody's going to hold you accountable. I said, well, what do you mean by that? I said, theoretically, if we said we're not going to do any contact tracing as a school system, we don't have to, like, correct. I said, well, I'm not going to recommend that, but I definitely would want to look at some sort of protocol where we can minimize the number of people who are in close contact, and then find some way to sort of mitigate whether it has to be 10 days. I'm only looking for 7. I'm not looking to be extreme. That 10, you know, after 5 days, that a parent can have a test to get it back. And I'm not suggesting any of these changes. I mean, maybe you want to. I'll throw this all out there. I'm just telling you the myriad of responses that we're getting, and then Jeannie is kind of saying that. I'm sure when Melissa speaks, she'll tell you the same thing. It's just, and then I talked to other schools. I had a reporter call me and basically saying, why do you have so many kids in quarantine? And I explained the protocol. She said, well, there are schools that aren't doing any of that stuff. Those kids aren't being quarantined at all. Then I want to say that, you know, of the people we're hearing from, which is not the majority of people, I think we need to be really careful as a community, because I think the majority of our parents would have expressed that they would support some sort of reasonable protocol or expectation that if there's a danger to our students and our staff, that we take measures to make sure that doesn't happen. Came up in our conversation today with Teresa and Marsha about, if we bring kids back, if we didn't do contact tracing at all and we just let anybody come in, that puts more kids and more staff in danger. You know, I don't know. I'm not personally willing to do that. I don't know how the school committee feels. But I guess what I'm saying to all of you, the reality that I got, and this is probably the best conversation I had with anybody, was ultimately, you guys can decide what you think the community would best support, and you can put it in place. All the way from, nobody's suggesting that we should say anybody's positive can come back to school, whatever. That's ridiculous. But I think, I don't know. That's why I sent out my email to you guys yesterday. I'm at a loss for giving you any guidance. I was hoping that Dr. McCollum was going to be here tonight, because I wanted to.
She's on her way.
She's on her way, okay. She was awesome. I had a great brief conversation with her. But these are,
I would say the PCR, you have to think it's expensive, and it won't be covered by insurance. So for some families to say you can test out and get 3 days, one, they're hard to find, right? I mean, they're back. It takes a few days for people to get one, and if a provider will order it for this reason. And also, some people are not gonna be able to pay for that. So their child is not gonna be able to have that option. It's almost gonna be, it kind of sets a tier of financial, and I do feel kind of uncomfortable about that.
Yeah. Quick question for you, and then you can speak, okay? So the test that you go through the drive-through at Walgreens, what's that?
That's
Is
a
that
rapid. It's
That's
called
a rapid?
Binax Abbott Rapid, but that's
And
that's
that is not-
highly sensitive when you're symptomatic.
You're symptomatic.
That's what it was developed for, that's what it was approved for. The PCR is any rapid one that gets sent to a lab that's positive, automatically the lab does a confirmative PCR. So the PCR is like the gold standard. The rapid is like you know, your rapid strep test that you
Yeah,
get
yeah.
when your kid has sore throat, and then they send it out and it becomes either a true positive or negative, so that's the analogy I give to parents.
And
It's-
that, am I to understand that that means that that would not be acceptable to get somebody to test back in if you went through Walgreens?
A rapid, no.
Right.
No.
No, it wouldn't. Okay, that's, I did not know that, so that's good to know. Melissa, what did you want to say?
Couple things. Obviously, most of you know I'm a parent too, so I had a daughter that was in quarantine from a daycare exposure, and I have to guinea pig on the PCR, right? So I called Winthrop Peds, got her PCR at day 5. It's gonna cost us money, right? It's not cheap, it's not, you know, it comes out of our insurance. So like, I have to say that I know that will be a concern for our community. I already know that. So if we do pool testing, I see both sides, I do. I don't have, it's gonna be a lot of work in the beginning, but I do see that if we are in the weekly pool testing, that's free for them, right, for our community.
Yep.
We have that kind of peace of mind catching those early asymptomatic carriers, because we know our little grade school kids are walking petri dishes. So, so there's that piece. I can tell you right now, I just looked, 10 minutes ago, of how many students at the grade school have signed up. There's about 30 or 25, 30 kids so far signed up. 2 of them
That just
are
went out today, right?
that just went out. Just went out, so just now, like 6 o'clock. So
Awesome.
I do see there is lots of questions about pool testing, especially because, as you know, we've had cases at the grade school, and there's been questions of, okay, well, if my kiddo was in pool testing, would they have to be in quarantine? Well, if they're not positive, no, they wouldn't. They could still be here in the classroom as long as we have staffing and teachers and able to do that, and everyone's healthy. So I guess I do see both sides. I do see if we have, 420 some odd students in our school. So if, say, a lot of them sign up, which I suspect that I do, they are recommending 7 to 10 swabs in a pool, right? So that could potentially be 2 pools in one classroom. Because there's,
What was the original pool size?
it used to be up to 20 or 25, but now they're asking for less because
They don't have
it-
as much.
because of the rapid testing. So if that positive pool is, that pool triggers a positive, we'll have to go around and test all 20 plus kiddos with a rapid. So they're asking to do less, so there's less likely to have as many rapids, because those are hard to get right now.
And did you just get, I don't know who would have, I think the rec department just gave us a bunch of rapids?
Yes, we did get donations from the rec department.
Yep.
They're in my office, and I will distribute to Jeannie too, but yes.
How many did we get?
Gosh, quite a few boxes. So
Yeah.
we would be good. We are using them for our close contact staff members at the grade school. And I've been going through quite a few a day. I'm just gonna be honest. There's quite a few a day.
Can I just expand this a little bit? The other question I had is, was there supposed to be a way that if you were in a class and somebody was positive, but you were vaccinated,
Yeah.
that you didn't have to quarantine?
That's true.
We're doing that.
Yep, so the CDC recommends vaccinated staff vaccinated individuals out there to test at 3 to 5 days. There's a lot of anxiety, I have to say, with some of the staff members, and they feel better to test themselves within like the 3, 4, 5 day mark, as long as they're asymptomatic. And I just feel like if that's just one simple little task that they want to do, I'm going to offer, unless we really know by Jim and Jolene. I think it is a peace of mind for them if they are close contact. And the exposure, right? The exposure here is dependent, right? If it's, they're getting exposed from individuals eating unmasked, right? Or teachers eating together, and most of them are vaccinated. So that is true, and that's the case. There are vaccinated individuals getting COVID as well, so we have to keep that in mind.
Well, I understand that, it's just that,
Mhm.
yeah, I get these questions
Yeah.
and I know where they get it from. I mean, the news says one thing, or you read it on
Yeah,
Facebook
But
or
that's
something.
true, I mean, you should feel better being vaccinated, right?
And,
And exposed.
But I was hoping everybody would get vaccinated.
But the reality is, we've had a number of people who have been vaccinated, you've had people who've been vaccinated who get COVID.
Mhm. Yeah.
Kelly?
I just wanted to revisit, Jim, and ask the question about your comment that, kind of also Jeannie's comment about US CDC versus Maine CDC versus DOE. So, it seems to me that, the CDC would have the better medical decisions that the DOE would have.
Yeah, I think, yes. I don't think, let me say it this way, I don't think, there is nothing I'm aware of that the DOE is recommending that the CDC doesn't also, but there are things that the CDC is recommending that the DOE hasn't necessarily adopted.
Right, so if the DOE has said, do whatever you wanna do,
Yeah.
then why aren't we adopting what the CDC, who are the more medical professionals, are adopting?
So what I'm saying, and again, Jeannie and Melissa are really the experts here, I think we have. I think in terms of this, if this student is positive, these people get close contacts, that's a CDC guideline, and that's what we follow.
Okay. But what about that?
Which- so this thing,
This one.
yeah, but let me, yeah, well, this is,
I haven't seen
oh, I
that
got you, you're right. Yeah, so we could certainly do that. That would be a great question for Dr. McCall, thank you for coming.
So glad you're here.
But let me go through, this is from the CDC as well, and this is contradictory to some of this, and let me just read. This is, and Joel had provided this, so this is what I specifically talked to Emily Poland about. This doesn't have, this is from the CDC, even though it doesn't say it on here. But it basically says, if it's classroom only exposure and there's no pool testing, which currently there is not because we haven't started yet, right? So no pool testing, but there's universal masking, which we have. Then the result is the student may continue to attend school if close contact is a student. No after-school sports or other community or school activities for 10-day quarantine. That's a contradiction to this. That exact same verbiage, I won't read the whole verbiage again, but here's the scenario. School-related exposure with pool testing, no masking. Well, again, it doesn't fit us, but it could have. Same thing, may continue to attend school and other school-related activities. No non-school activities for 10-day quarantine. I did read it again. And here's the one that actually technically fits us or where we're going to be. A school-related exposure, pool testing, masking, may continue to attend school, and blah, 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 blah. Here's what I don't understand. All the rest of these scenarios are community exposure. All of them require quarantine for 10 days. I don't understand. I mean, to me, and Sue and I've asked this of each other multiple times, what difference does it make where the exposure happened?
So,
And why the difference in the yeah, absolutely.
is one of these from Maine CDC and one from Federal?
This is Maine CDC, right, Joel?
Maine has.
Yes,
This
Maine.
green paper, is that Maine?
This is Maine, yep.
Can I
Yep.
read that?
Can I just, it's only one excerpt
That's
from
okay.
it. Yeah, and it was from a parent who asked why their child couldn't test back in, and I asked, I think it was a meeting, I think Jeannie, was it the meeting you were at, Jeannie, with the A-team, and you said that, and actually you or Megan pointed out the difference between the DOE and the CDC they're not 100% overlapped.
Thanks.
So, and I don't know, and ultimately, I shared this with the policy committee, we were just kind of talking about this before. If you follow that quarantining analogy that's here, then the numbers that we actually have in quarantine right now are not unreasonable. I would just say this, that if last year with what we had in place, our school, our grade school in particular, would be closed now. And that would be, I think, really sad because we have, I think, 10 positive cases. Is that what it is, Melissa?
when are you starting the date from 10?
What?
What's the date that you start?
10 today or
Today.
10 last week?
10
Ten
thus
thus
far.
far.
We've had 12 since,
12, okay, so we.
12 since 8:30.
Yep, okay.
This morning?
So we have 12, so
August.
if following this simple diagram, if we had 12 positive student exposures, we would expect 48 additional quarantine students. So, we're at about 60, right?
57.
57? That's pretty close to 60.
It's
I'm
up-
being
it's
exact.
up-
Did I ever do math with you?
Yeah.
That's up to
I
you.
knew you were gonna
Yeah.
ask me, so I wrote it down. I
Yeah,
wouldn't know that.
yeah, I knew you would.
Wow, that's a lot of people.
But
It
that
is, except it's
includes
1 to 4. Last year, we were quarantining 1 to 30. We were
Yeah.
quarantining entire
Yeah.
school buses.
Absolutely. And for instance, I'm just gonna give you an example. Last week when we had our first positive on the first day of school, we.
First hour of school.
Literally the first day that, right? Yep, first day. Jolene's shaking her head. We looked at the classroom and then the cafeteria, talked to the teacher. Jolene and I kind of said, okay, you know what? I think there were 9 that we had to quarantine. Most of it came from the cafeteria exposure. Just the way where they sat. The next student that was positive, I don't even know, I'm getting all mixed up with it. I think there were 8 close contacts.
Half the
Um,
class.
huh?
Half the class.
Half a class, and a few from a different class. But,
Yeah.
it used to be, 30 to 60 each time, 20 to 30 last year.
But you do have a school,
Huh.
you do have a school, in-school spread, most likely, this week.
Yeah,
which we
so
haven't
this
had
week it's
before.
been concerning it's been eye-opening really, and it's like, what is happening? But yeah, I mean, we currently have 2 classes in quarantine, and out of 1, that first positive, there's now 2 linked to that.
In school.
So
From
classroom
in
spread.
school.
Yeah.
Yeah, transmission. So, I mean, it's there, it's happening. So when we get that positive, we have to look at the whole picture of what, is it a child? Is it a staff member? Is it a vaccinated staff member or is it an unvaccinated staff member? What are they doing in the classroom? And that's where the experts come in. I'm in my own little bubble and I can do contact tracing like no tomorrow, but, there hasn't been, knock on wood now, but there was no bus involvement. But it is concerning that there is that transmission happening. And it's just a reality that we're living in right now. And so.
Hi, can you give me your name?
Yeah, it's Jason Hashim.
Thank you.
So from that first quarantining, my kid was one of those. So were those other 2 positives that came from it?
No. There were no positives that came out of the first.
Okay.
Yep, no, there were none. And that's it's working, right? The spacing, the distancing, it's the exposure, right? The contagious period. If that person tests positive, again, child versus adult, there's a huge difference. And
Can you explain that to me? Because that was gonna be my question. I know on the exemptions from quarantining and schools that enforce mandatory masking policy,
yeah.
it has to be that the close contact and the positive case are students. Can you explain to me why that is? Why can't it be a teacher? That if a teacher is positive, why is it a different standard than if it's?
Because of transmission.
What does that mean though?
So the viral load, and I don't know, I don't want to say it incorrectly, but how I explain it is when there's a teacher that has COVID, there's a huge difference between an unvaccinated adult teacher and a vaccinated adult teacher and the viral load that they're going to spread.
Can you clarify that?
So I guess, so why
Did you
is,
get my question? Did you understand?
why is it different between a student versus a teacher?
Right, so the way I read this is, so say there's a student that is exposed to a COVID positive teacher,
Yes,
they do not meet the criteria for being exempt from being quarantined. But if they're exposed to another student who is COVID positive, and they're wearing the mask,
yeah.
they are exempt from having to be quarantined.
So and is that once we start pool testing or now?
Now,
Okay, so some of that has to do with scenario.
okay.
So what happens often when we get a positive is I get a text that says, hey, got a minute? Want to run a scenario by you?
Mhm.
Because all these are so different.
Mhm.
So let's say, just for example, you have a couple fourth graders sitting at their seats, masked most of the time, know where they are during lunchtime when they're unmasked and eating, and only unmasked for mask breaks if they're sitting quietly. So if you got a positive in that kind of classroom, then you may get away, you may be able to say, no, we don't have to worry about it, because we're following really good guidelines in terms of what we know works. A teacher, however, may be moving around the classroom, may be trying to teach, may be trying to help students, and adults are more likely to spread than children in that scenario. That would go back and also answer your question, why in the community, if you're exposed in the community, do you have to quarantine? Because we have a lot less control. Let's say you're at a church event, or let's say you're at a spaghetti supper, or X, Y, or Z. So in that situation, we don't know, were you really masked? Were you eating in a setting? So what we've seen very, very little in-school spread, but we're seeing it. And it's certain situations. We don't want to go into details, but it's certain situations where we're seeing this because it's much harder to control. Whereas in the community, you see incredible spread very quickly, and that's why we try to contain that as quickly as we can. Does that help?
Yes.
Jen, in addition to that, one of the things that nobody's talked about, and I think to me it's a huge point when I'm having conversations, particularly with you a lot, Melissa, is it's not only, you talked about the teachers, and I was asked a lot today about why those whole classrooms had to do with it, because it really has to do with when the positive test happens, and then go back a couple days or 2 days, go back 2 days.
Yeah.
And so you look at the length of exposure over a period of, not just
That's true.
that morning,
That's
it's over those 2 days. And so you can take a look at the classroom in there, and you know the teacher, any teacher doing the job is gonna be up and about in the room.
Right.
And so all of those students clearly have had exposure for more than 15 minutes, probably within 3 feet. May or may not be with the mask on, even though that's the expectation. But again, as you just said, it made me think of it that we don't know that 100%. So that's why those two classes in particular were the entire class as opposed to, whatever. I guess I want to ask you this question, but it's really for you guys as well. So are you saying that what this is saying is, so if we determine it's a classroom or a school exposure, that the close contacts don't need to quarantine?
That was gonna be my question.
No, I think it's gotta be case by case. I think once we do pool testing, it'll be much easier to say, we can relax, this classroom's good, we're gonna keep an eye on them, make sure they're not asymptomatic carriers. But no, most of the time, if you've got a COVID positive case, they need to be quarantined. Unless you can keep testing them, that's the problem. So,
That's within the people who are within 3 feet according to
Correct.
guidelines.
That's correct.
So this scenario of one positive, you're essentially gonna have 4 close contacts, is accurate.
Most commonly, that's right. Now, if you have an unvaccinated teacher who's, all of a sudden realizes, hey, those weren't allergy symptoms, and hey, X, Y, or Z, or hey, I just realized my exposure was 5 days ago, then you got a whole classroom.
Yeah.
What about looking at the 10 days? Can we look at maybe
Yeah, that's-
fixing that.
From the very
10
beginning,
days seems extreme.
I want to go way back to last fall, and I know I've had some conversations, I know that there's some sense of what we've done in terms of the O2 prime, whatever, doesn't mitigate anything. But I guess I'm frustrated that if the CDC said, you know, we took a look at the devices that you have in place, and while we think they're a really good thing to do, it's preventative, it's, you know, it's positive, but it doesn't change a thing, that would be okay, but I haven't been able to get that answer. So all along, I've had the question that Tim just said. Is there some way to mitigate the 10 days, even to 7, to make it reasonably safe to bring those kiddos back, staff back?
For mass kids that are socially distant,
Yeah.
I mean, 10 days, it's 2 weeks, it's half a month
Yeah.
after schooling.
Well, then there's those who could possibly live with someone and their 10 days don't start until the 10 days are up for the first, so they're out for 20.
That's right.
I have kids that are like that, and it's all over the place.
They come- they can come
I've
back
seen
and do
people
another 2
out
weeks.
of work for 21 days.
Yeah.
Well, we do have a situation, a teaching situation, I won't say where, but where the person is out now and is basically is not positive, but has to wait for their child to finish their 10 days, and then their 10 days start, so they're out for 20 days.
And I'd be in the same boat with my youngest just got, and I'm pretty, this over here in this, but I do agree on the classroom.
Yeah, I mean, it's a no-brainer,
Yeah,
unfortunately,
you know what I mean?
I know.
But,
I didn't get an email from you, so I was
yeah,
like,
so you
okay.
know that.
We're on good
Usually I'm like,
terms.
but,
It's quarantining our own, so that's good.
I have to do it too, I feel you, I can.
but I would have been out 2 weeks of teaching,
Yeah.
if I hadn't had my mom here.
Yeah.
I had my mom, if it wasn't for my mom, I don't know what I would do. I'd be out.
I hear you.
I will say, and the 10 days of things long, I think last time I was here I said that, and now I will say that there is recently, not breaching confidentiality, but assume that there was a student that was vaccinated and positive and had to quarantine, and they're out of school, and then on day 7 or 8 of their quarantine, they become very sick and end up being transported to a regional hospital with high blood sugar and fatigue and lethargy. This is a day 8, sailing along on their quarantine. So just when I think I can randomly pick 10's too long, a real life close to home.
But is that a
But
positive
that
person?
was that the case, not a close
Right,
contact?
but again, if I was a
No,
parent,
a close contact that turned into a positive.
that close contact that turned into positive.
But that person didn't have a PCR to see if they were negative after day 5.
Correct, but I just think there's a lot of pieces that we'll have to add. I would feel comfortable if we try to cut back that 10-day. I think there's some pieces to it we have to add, like a PCR, and again, then you get into that. Because and maybe that's just one, but if that was my child, or I had a child around that child, that's
So-
pretty concerning.
So
Pretty
Jeannie, I'm
scary.
100% sensitive to, and I don't like to create any scenarios where we create haves and have-nots, but it's very challenging for me as a superintendent to have somebody call and say, we'll pay, exactly what you said, if we want our child to get a PCR, we can get them a PCR after 5 days. The other person that sent me the thing you were just looking at, Kelly, and said, the CDC says we can do it. And I said, well, and that's why, thank God I brought the administrative team together to say, that's not adopted by the DOE, so we can't do it. That was very hard to go back and say, I know the CDC says yes, but the DOE says no, and I can't do anything about that. But I would like to, I don't know, I'm not necessarily,
I'd like to find a way to get the kids back into school
yeah.
shorter than 10 days.
Can I say something though, to say if you have a classroom full, I'm talking classroom quarantine?
You keep them quarantined.
Okay, so just because if, say, half of them test out, who's gonna teach them when they come in?
I think like what happens in
Yeah.
that classroom,
No.
just keep them out 10 days. But it's the kids that are, it's like if I'm masked the full day and Janet's masked and I'm now in close contact, I'm like, 10 days? Those are the things that I'm kind of like, the social emotional well-being of the kid. I mean, that's, to me, this piece is more damaging than the health.
Gentleman in his hand up again.
Yes.
So when do we start the pool testing? Because I've already had to take time off of work, and I'm lucky I'm self-employed, but I kind of went out on a whim with my kid and did what I figured would be best with him education-wise, but we didn't get any information from his teacher, and then the communication back and forth didn't really come through very well when I went through Nurse Melissa, and I actually had to reach out directly to the teacher to find out if he had been given any work during that time frame. And my big question is, why don't we have a camera in every classroom for those small groups of kids that have been pulled out? Because I'm lucky I can be within distance of my kid and he's in walking distance of my warehouse, but it's kind of really unpleasant. We've had a year and a half to figure out parts of this. And if we can figure out ways to get students for sports to events, why don't we have a camera in every classroom for those of us that need it? What if I didn't work but from my own company? What if I had to take time off of work to watch my kid? I got a 6-year-old and a 10-year-old. I'm not happy hearing that we've had a year and a half of this and nobody has an answer on that one. Because then that means no daycare. That also means that my ex-wife and I have to battle out which one of us is taking time off work. And that's not fun.
So I know there are schools that are working very hard to do what's called synchronous learning with teachers and students that are suddenly being quarantined, and it's a nightmare. And unfortunately, it's just a nightmare because you got teachers, I mean, some of the administrators can probably talk to this as well, but you got administrators that are teachers that are trying to pay attention to their kids, keep their mask on, keep talking, keep teaching. And then suddenly, Miss So-and-so, I can't see you. I can't, it's really, unfortunately, unless every classroom had then an IT tech who could run a camera and make sure that the kid's on computer, but we can't afford that. It's a nightmare. So I hear you. I mean, I used to be self-employed when my kids were in school. That was handy. Now I'm not, and if I was having to get quarantined. So I think the bigger piece, in my opinion, is getting pool testing up and running, and then I think giving us a couple more months. I mean, if you read the newspaper, if you look, at any of the state-based stuff, there's just thousands of school districts that are just struggling with exactly that, because you are absolutely right. We need kids in school, and then if we can't have them in school, how are we going to educate them? And you're right, but I think that it's not as...
So that comes back to my whole point about the sports thing. Why are we doing sports if we're worried about that? That's a huge area
We're also doing sports again, you're not seeing spread in sports. So if you sit down and you really look at the data on where cases are, they're not, occasionally you'll get a football team wiped out or a soccer team that's, all quarantined. But that is not where spread is happening. But yeah, if a kid is there's even stuff in there that says kid can come back, go to school, but then goes home and doesn't do any after school activities. So that's actually even clearer than last year, and that's the direction we're moving. So you're right, I'm not disagreeing at all.
Can I answer your first question though? Pool testing, the information went out tonight from all 3 schools. You have until September 30th you can go online, the information is there to fill out the form if you opt in. Obviously, it's a voluntary thing, right? So you don't have it.
That's easy.
Yeah. Anyway, so you go in and fill out the form, and then there is a process for training, and so our hope is to have it up and running by the first week or second week of October.
Is the PCR going to be run here on campus, or is it going to be run somewhere else?
The Rapids is here on campus, yeah. And the testing for the pool will happen in school.
The pool test gets sent out. And then if one of the kids in the classroom if it's identified as positive, then we do the rapids right in the school. Yeah, so you don't have to take them to the, doctor or Walgreens. We will run all the rapids from a place right in the
my kid's doctor was instantaneous when I told her what happened, and we didn't have a problem. We had Walgreens and then we had at the
Yeah,
Winthrop Family Medicine.
yeah, Walgreens has been
Pretty good.
very good.
Kelly?
Yeah.
Kind of jumping off his concern a little bit, and I emailed you about my concern as well. Without sounding negative, it seems like we went into this school year somewhat with rose-colored glasses, as far as not having a plan for how we would educate kids while they were on quarantine. Because we automatically said we are not doing remote learning. That's off the table. But then these kids are on quarantine and their teachers are not necessarily, I'm not gonna say across the board, no one, but some teachers are not reaching out to their families to say, hey, maybe your kid can do these worksheets, or hey, maybe, I've got some great resources on my website that your kids can do, but what's the plan now?
So I met with all of the PLCs at the grade school today, and I've talked to a number of parents, and I will own part of that, because we did not foresee, so I guess in that respect, hindsight being 20/20, you're right. I don't think any of us foresaw that we were gonna have, we had, I don't know how many in-school cases last year. We did not foresee we were gonna have, starting on day one, that we're gonna have these cases. So had we known that, we would have probably said on the 2 days that you have to get ready for school, we're gonna need you to plan for packets for students who will be quarantined in the first 10 days of school. We didn't quarantine a kid last year until, it was, and we did get slammed in the spring, but so we didn't see that. So I own part of that, but I will tell you that the administrative team and they're all did, that's what they all did today. They planned for red, if so to speak, and quite frankly, planning for red is simple. The situation where the whole classes are quarantining, they're all doing remote learning, that's simple. It's the ones that are missing 3, 4, 5 kids from their class, where they have to prepare something additional for them is the bigger challenge. So all of them, all of the schools, and the high school has a different plan than the middle school, but those learners are all different. I can tell you from meeting with all the PLCs today that the grade school, the younger grades, at least the pre-K2, is looking at what we call a low-tech packets that would go to families. And I did hear that. I thought the families who called, who talked to me directly, and Jolene, God knows, talked to enough herself, I think they understood that. I think there was some frustration, and they were like, we'll address it, and we'll get stuff to you as quickly as we can. And so, yeah, you're right. But at the same time, there are other things that we wanted people to have time to be able to do. And had somebody said, and I don't know who would have said this to us, because I have to tell you, Winthrop is slammed harder than any other school that I'm familiar with in all of Kennebec Valley. I wanted to share this before I forget. I follow the number of positive cases in Winthrop on a weekly basis. CDC puts that information out by town, so I've been following it since July. The most number of positive cases that has been in any 1 week, this is for the whole community, it's not just kids, was 7 from the middle of July until now. This week alone was 18. So, it's, I don't know what that means. I said today, does that mean Dr. McConnell said last time she was here that the Delta variant is very rapid, it's very aggressive, but it's also quicker. Is that am I using the right term, Jen?
Mm-hmm.
Yeah, so, I don't know, is 18, is that the peak? We don't know. So I would say, to answer your question directly, I think moving forward, I think we're well prepared for anybody who has to quarantine to have the work that they need. And I will say in defense of Jolene, because she and I spoke about it initially, particularly because of the shock value of what happened in the beginning, the first thing that needed to happen was we need to get those kids home.
Right.
Then we think about how to communicate with them in terms of what to do, what not to do.
So, are the teachers made aware that their student is quarantining as a close contact? And I ask that question because one of my son's friends was quarantining, and the teacher said, hey, is your friend okay? I have no idea why they're not in school.
Yes, they do know that. I don't know why that would happen, but yes, they do. And
Okay.
Melissa's shaking her head, yes, but we do, I mean, it's not like we do this wide broadcast. It's one of the things I talked to the
Well, I would think
association
it's a
about.
need to know kind of
Exactly.
situation, but I
Exactly.
would think that a classroom teacher would need to know which
That-
students are.
I would agree.
Kelly, I can tell you about the process here. I email immediately the teacher and CC Jolene. Your child, that your student will be out for a tentative date of this, or until you hear otherwise, or, because it can vary depending on the situation at home.
And in the high school, middle school, I don't know, they have a bunch of teachers, I always email Mark or Sue, Ari, guidance, and the secretaries, and say this person will, tentative date return is like 9/20. I don't say why, but it's, because they don't need to know why unless they need to, but you kind of get a hint if someone's out for 10 days, that's probably what it is, so.
That's your way down.
Right.
Jolene?
I just wanted to mention too, the shortage of subs. And Jim and I have had this conversation also. Right now, I cannot get an outside sub to come to the grade school. I had one today. And I think Sue has one in special ed with her right now, but we just don't have any substitute teachers. And so we have interventionists who are currently covering to keep all of our kiddos in school that are still in school. So it also creates a situation where if you have a teacher who is out sick, I can't even cover the kids that I have here at school. So to hire someone for the possibility of a classroom that's quarantined it's just impossible. We have no substitute teachers that are coming in, and we have a lengthy list of substitute teachers who are no longer willing to sub. So when this all started to take place, Dorian Edwin, the administrative assistant, I said to her, here's the sub list, could you please start calling? To no avail. So right now I have 3 Learning Lab educators and the COVID ed tech and the COVID teacher, 5 that are filling in all over. And I also mentioned to Jim my concern of that, because I know it's challenging for everyone, but my job as being a principal is also supporting and lifting and making sure the staff is okay. And it's very wearing on the staff. And we're only in our 3rd week of school. And I don't want anyone to feel badly about that. I just wanted to bring it to your awareness. So we are.
Substituting everywhere. Correct. There has been.
Right. And I kudos to the staff, the grade school staff, as I'm sure middle school and high school too, but they are fabulous. I put out emails at night and, here's where I need you for tomorrow. Could you please do this, do that? And people are just stepping up and doing that and still smiling as they're doing it. I'm not sure how long we can hold the fort like that. But we are working really hard. We want the community's we want the Winthrop grade school children in school. So I just wanted to bring that to your awareness, so you're aware of the fact that it's not as simple as calling and say, you know what, I need you to sub for the next 2 weeks. I can't even get people to sub for tomorrow. I figured out this afternoon how we're going to open tomorrow. And I actually have figured out for Friday too, as long as no one else calls in sick or nothing else happens. So.
I think you have your hand
I did, yes. So with the grade school, since I've already been affected by this once in the beginning of the year, or beginning of the week, can we have all the teachers upload everything to Seesaw? Because if I've got a 6-year-old in 1st grade that's going to be out, I can manage him in my warehouse comfortably. But if I got both kids out and only one teacher sent information, I got nothing to work with. And I'm lucky, again, because I'm self-employed and I can work from home if necessary. But I think that would help curb quite a bit of this back and forth with how are we going to teach the kids. I mean, I got a degree in biochemical engineering. My kids aren't stupid. They'll figure it out real quick. So it's one of those things of this for grade 5 and below would probably simplify a big portion of our issue.
Go ahead, Joe, and then I have a question.
Do you want me to go? Okay. So you are exactly right. And the 2 days that we had before school, we were preparing to open school.
Yeah.
And those Seesaw accounts are just getting all set up and running.
I've noticed
So-
I'm getting emails from it like every 10 minutes.
Oh, okay,
Yeah,
yay!
it's literally bouncing back and forth. And honestly, I've gotten 3 emails from Seesaw in the last 20 minutes here.
Yay.
And I'm kind of looking at it going, well, why aren't we utilizing that to a full capacity?
We are. So that was my next thing to say. So K2 uses Seesaw, and then 3 through 5 uses Google Classroom.
Didn't know that.
Yes.
Yeah, so I don't have anything from Google Classroom, and if they've sent it to my ex-wife, I definitely don't have it.
Okay.
So,
You know what? You can send me an email, or you can even email your teacher. Either way, and let me know, and then I can make sure that happens.
And
But we
unfortunately,
are
he was
working on that.
impacted. He was the first group, the 8 that had to quarantine. So Felix, his son was one of the first.
yeah, Felix, I mean, he's pretty easy to work with, so it's pretty nice, but
And I know you guys just worked on things today.
Yes.
Would it be helpful, do you think, to send something out to the parents to let them know what you guys have done today? That you used today to go over these plans and to be expecting these things so that they know what's coming? Just a thought.
I would certainly do that. I would gladly do that communication piece. So I can take care of that tomorrow and send a blast out and let them know where to find it, and yes, I will do that. Thank
So-
you.
yeah, that'd be great. So the other thing too is the way the communication system works, where it's text message, phone call, and then go check the website. When we get that email, can you guys put a link directly into it so that I don't have to jump off, go to the website, and then dig around to find the letter? Because that drives everyone crazy. I'm not the only parent that has a problem with that, because there's no link in the email saying, hey, click here. This is the latest update today.
Thank you.
I mean,
Great idea.
we got an IT department, right?
Yeah, and
That should be something that they should have like solved right away, saying, why are we sending to a website that's poorly laid out?
But on a cell phone for sure, it's not optimized that way, but, kind of jumping off that, I don't remember, and it was 5 grades ago, I don't remember how or when I signed up for that blast. Did I opt for all 3, and is there a way to opt for just emails or
Yes.
just text messages? And how do we go about doing that? Because it's crazy to have the home phone ring, both of our cell phones ring, both of us getting texts, both of us getting emails.
Yeah.
I'll be reading the text and my phone's blowing up with a possible spam call, and I don't answer those.
Yeah. I
So
have-
the answer is yes, you can contact the school's administrative assistants, usually send out the blast.
Yes.
And they can manage that in terms of what numbers get called.
So can that be included in the next blast of contact so-and-so or maybe a form that goes home that says, how do you want to be contacted, all 3 or just 1 or 2? And that way they're not getting 1,000,005 phone calls saying,
So-
hey, can you do this? They can do it.
I question whether or not it will have the capability of your house, it's just cell phone.
And
And
then
my
you
house,
can-
it does?
Yep,
Good.
it's a different name, but it's the same system that we had where it was before, and you can edit that.
Because I watched Denise do it today, that's why I questioned it.
Sue Fawcett, did you have a question?
I had a comment that was back to talking about what Jolene was saying with our subs and what have you. Just so you have some hard data on this, and this is district-wide data. We were really strong at the beginning of the year. We were getting 100% coverage in our buildings. Fill rates is what we're looking at. We've been as low as 17% fill rate for absences. We're running about 56% coverage right now for fill rates over 10 days, which is significant, especially when you don't have staff You know, especially in special education, where we're short a special ed teacher at the high school. We have 2 ed tech positions here at the grade school, which is where we've significantly been impacted, which is requiring lots of people to do lots of things and be really creative, especially when it's one-on-ones with students that have significant needs. It's been great to be in the classroom, I will say that right up front. I've spent a lot of time in the classroom in the last 3 weeks, whether I've been a life skills teacher or an ed tech. It's been fantastic, but like Jolene said, it is draining on our staff. I am not sure how much longer some of these folks are going to be able to make it.
Thank you. Go ahead, Jane.
I need to speak from a teacher's point of view for just a moment. And I appreciate what parents are going through. I can't even imagine that part of it. But in the past 3 weeks, I think week 1 I had 3 kids out, week 2 I had 4 kids out, week 1, 2, 3. I just had 4 kids with 2 positive cases today, with probably more kids having to go out in quarantine. We haven't had a year and a half to prepare for this. This is completely different than it was last year, which was completely different from it was when we went out in March. We have taken away all the time that we gave teachers last year in this district to plan for these situations. So that's number 1. They're doing their planning at night when you have to figure out how to cover your classes tomorrow. In my district, they told me to treat it like a kid's on vacation for 2 weeks. And what would you do if a kid was on vacation for 2 weeks? What would you give them for work? It's not that easy. It's not that easy when I teach 60 kids and I have 12 or 13 of them out at different times and coming back at different times. It doesn't help when some of them have technology at home and some of them don't, and I don't know that, and now we have no hotspots at home to help those that don't have hotspots. We are figuring it out day to day too. We are struggling with kids being sick, with family members being sick, with us having to quarantine. So I just want to say as well that I know teachers are trying, and it is frustrating. We don't always know who is positive because we can't. Sometimes we can figure it out, but we don't know. We don't know necessarily how close we were to that kid. They might be in the back of the room, so we're not a close contact. But as a teacher, we are moving around the classroom, so it's frustrating on that end as well. So I just feel like I need to say, from a teacher's point of view, it's hard. You don't know what's going to happen tomorrow, and you don't know what your classroom's going to look like. Am I going to have 10 kids out of this class and 5 out of this class? Am I going to have a whole class quarantined? So we're frustrated too. And I hope, I know that we've taken our Wednesdays away from teachers to do, or I think it was Wednesdays, it's Wednesdays at my district, to do that, have that planning time to do that. And then I know with the new school year, we have all these initiatives that we have to throw on, and we have our professional goals and our personal goals, and teachers are all having to get that stuff ready because that's all due by the end of the month. So it's frustrating for us too. We want to provide these kids an education. I don't want my kids home. I want to give them something meaningful. I don't want to necessarily just give them worksheets to do. I also can't plan for a 90-minute class at home for that student. So even though we do give them work, it's not going to fill up an 8-hour, 6-hour day for parents. And I know that's frustrating for them as well. But it's figuring out what is best for kids and how do we do that. There is no module to follow that says what we need to do. So communication is key. I've had several parents reach out to me and I'm like, we're trying to get stuff together. We don't even have all of our technology home. So I just want to say that as well, that people are trying and it's new for us too. So I just wanted to put that out there too.
Dr. McConnell?
I want to add to that because we're seeing this in healthcare and I don't think we focus on this enough in schools. And that is teachers are also scared. You know, they suddenly get the call that they've got a kid in their class who's now got COVID. Teachers may be pregnant, they may have little ones at home, they may have parents that they're taking care of. I mean, teachers are scared. We're all, you know, also exhausted. We talk about, we're having tons of burnout. I'm not worried about the vaccination mandate and what's happening in healthcare. I'm worried about burnout. I'm worried about that people are just exhausted. And teachers are very similar. And I don't think they get enough credit or enough kudos. I mean, administrators too, trying to find subs, it's just, and I live with a principal who's just, you know, every day, 5 a.m., on her phone, texting, figuring out what the plan is gonna be. So you guys, I agree. Nobody is purposefully sitting down saying, too bad, 3 kids in quarantine, guess they're not getting educated within 10 days. You're absolutely right. People are scared, they're exhausted, and they're working really, really hard. And unfortunately, I think in a couple of weeks, a lot of this is gonna change again. We don't know what it's gonna look like.
We don't know which way it's gonna
Right.
change.
That's right. I mean, you think you're struggling with making sure we have remote learning? You know, I need to figure out how to do telehealth visits with people and not get paid because insurances aren't paying. You know, they stopped paying for telehealth visits, and yet I got all kinds of people with COVID or COVID exposure, and I can't take care of them and get paid. And then we're running out of ventilators. We're running out of ICU beds. I've got a very good friend who had surgery on a glioblastoma this morning. He spent 2 days in a hallway over the weekend waiting for a bed because 80% of COVID cases in hospitals are unvaccinated people. 83%. 17% are vaccinated. They're a lot less likely to die, but they can still die. But when you look at the ratio of the number of people vaccinated and the number of people not vaccinated, and then you look at who's sitting in the hospital, 83% are unvaccinated. So you guys are exhausted. And it's okay to take a breath and say, I'm sorry. Here are some worksheets. We're doing the best we can. This sucks for everybody, but none of us have been through a pandemic before. And you're doing amazing.
So I just wanted, it's a nice segue, and we didn't even set that up, Jen, but one of the things that we talked about with the association today was, you know, we don't meet again for 3 weeks. We usually meet every 2. So I'm be very curious to see what the next 3 weeks brings us. We may be sitting here 3 weeks from now talking about what can we do. I don't know if it's harder than it is now, which is hard to imagine, but it's very likely. If it's lets up somewhat, then it might be. But at some point we need to think about. Right now, I think we're really focused. I think our commitment is on 5 days a week school and getting people there. But we may have to think about how do we take care of the caretakers and sort of share that wealth, so to speak. And that's going to be a really hard conversation because one of the things that I shared with all of the PLCs today, and I was so happy to hear all of the teachers, I would say virtually 100%, who provided some feedback when I said, well, I'm hearing through the grapevine that people are wondering why we're not closing school. Last year we had to close school, there's zero doubt about it. And when I said that, especially starting with the 1st grade and 2nd grade teachers, are like, please do not close the school. We need to be, we know it's hard, but we are 100% committed. That's on day 10. Let's see where they are on day 31. And they also recognize this. We have, and I was saying 60, it's 57, right, Melissa? We have 57 kids at the grade school who are in quarantine right now. That means we have 340 plus who are not. And we want our kids in school. We want our parents to be able to work. We want things to be as normal, whatever that word is anymore, as possible. But at some point we need to think about the entire total toll and there was some suggestions about maybe we add some at some point. And I said I don't think we're ready to even have this conversation now, but just to sort of plant the seed. We have one release day a month. Do we consider more? Not every Wednesday, not go back to that type of thing. I think our community has been exceptionally supportive. We're very blessed to be here in Winthrop with parents who are supportive and knowledgeable and understanding. But maybe we look at adding some of those things in. I'm not suggesting anything tonight. I think we take a look at the next 3 weeks, see what happens over that time, and then come back in 3 weeks and say, where are we?
Did Representative Hasselfuss want to add anything, or has he
Yes.
learned that tomorrow we'll have a special session and we're going to take care of some of these problems?
I'm here to listen. If anybody has any specific questions for me, I'm happy to do my best to answer them. Bear in mind that I'm not a doctor, I'm not an epidemiologist, I'm not an expert. But what I can do is I can listen to the concerns of this community, and I can take them to Augusta and, try to make things better on a state level if possible. So I just came tonight to listen, hear how things are going, and see if there's anything I can do to make it a little bit easier for this community.
Thank you.
And I also want to publicly thank Representative. He spent over an hour with Sue and I yesterday, the day before. I forgot what day, yesterday? Yeah. Yesterday. And everybody's really, really busy. Everything's crazy, but he cut out some time to spend with us, and I very much appreciate that. So thank you very much.
Thank you. Yes.
I have one more thing to add.
Sure.
I 100% agree with you. You guys are totally beat the shit out of. And growing up in California and getting my education there, teachers weren't treated for shit. No matter where you are in the country, you guys get far less respect than you deserve and should earn. Because we can't raise our kids without you. Period. No ifs, ands, or buts. You guys are 100% the reason why we have functional adults going forward. So please don't take any of my frustration at anything with the teachers. It's administration, because we've had a bit of time at this point to at least have the worst case scenario. And that's where my frustration is. I'd like to see some kind of classroom thing where we have a camera in there, so even if my kids can't communicate back and forth with teachers, they can see what's happening. And that makes a big difference, because my kids will be sucked into their computer at that point and they don't care what's on there. It could be a lesson about snakes, which if you know my kids, that's all they're obsessed with. Yeah, it's kind of disturbing, but I blame that on me because we own a large operation of breeding animals and manufacturing aquariums and terrariums. So 100%, you put it on a screen, they're gonna be on it. And that's what I'd like to see, some kind of initiative there, because if in 3 weeks it's gonna change again, we should already be planning about what the worst case is gonna be and at least building to that. So.
Thank you.
And I have to just, maybe, whatever, I don't need to say this, but I just want to say it. I've had the honor, I guess, of being in this profession almost as long as Mr. Campbell. But I've done this job for a long time. I've been a superintendent for 18 years, and I've been in 12 other school systems other than here in Winthrop. And I think I listened to I was on the phone for a lengthy time today with one of my superintendent friends who just said, I'm done. I'm resigning next week, I'm done. Which was really, really sad to hear. But what I got from him and what I got from other people is communities are really famous for doing this whole notion of circling the wagons and shooting at each other. We don't do that here. Certainly there are people who are frustrated and they take some pop shots and stuff like that. But for the most part, I think your sentiments speak to a lot of the parents I've spoken to, their frustrations, but I think they would say the same thing. Their frustrations are with me, or their frustrations are with, whatever, a process, but they would be the first ones to say exactly what you said with respect to the teachers. So I'm thankful that Winthrop is not a community that circles the wagons and shoots at each other. So, thank you for your comments.
The best thing we can do is use this as your resources.
Absolutely.
And, some of us are super close connected to the community, so we can help as best we can.
There's a position open on school board.
I brought that up to her.
I just to kind of go back to pool testing. He is funny to talk to. I see him outside all the time, so we chat quite often. I'm like, where's Felix? He's supposed to be quarantined. What are you doing? I'm teasing. Pool testing, and I'm gonna, obviously, I know there's a lot of work. I honestly very much miss Wednesdays, not as a parent, but as a staff member and a nurse. I am up very late. People get emails late at night, or I'll schedule it for the morning because I'm a night owl, and like, what are you doing? Do you sleep? Obviously, I keep reminding myself of one person. Jolene, we've had a lot of heart-to-heart conversations. Jeannie and I, there's 2 nurses here in your district, and there's no nurse subs. And that's a reality, as there's no nurse, teacher subs, there's no ed tech subs, there's no one, right? I had to take off Monday because my daughter was quarantined, and last week my father-in-law watched her, so I can say thank goodness for grandparents that he's vaccinated. I felt like, okay, she's good, she's got a negative PCR, we're good. But it's hard, and I hear people, I talk to them all the time, and I hear mental health is huge, and mom cried to me today, and I feel that. But so on Monday when I was out, Jolene and Debbie were the nurses. I texted her, I said, how's it going, Nurse Debbie, our assistant principal? She's like, no. But there's a handful of kids that are on medications that they have to take them every day. And obviously lots of other stuff. I was on call, I did a lot of work from home when I could, but I want pool testing to happen because I feel like that's the consensus that I hear and feel, and I think it is the right thing to do. I am still concerned about the help. We do have one nurse that happened to show up, and shame on me. Anyway, we do have a nurse from the company that is available when we start, but that's one nurse. I do feel like when we see and hear from other districts, depending on how many pools you have, how much time it is. Honestly, I am only doing COVID stuff right now. I haven't done any normal nursing, like my normal stuff that we had a broken bone, so I was like, oh wow, there's normal, broken stuff, but you get the point. But I am concerned that we're and we're going to be swabbing people, we're going to have more exposures. Obviously, we're going to wear the protection that we need and all of that, so I'm not super concerned about that, but it's a reality. We are hearing there are COVID cases, we are seeing there are COVID cases that are with vaccinated staff members. So I just want you guys to be aware that that's where I am feeling, like the stress of like when it's starting, because I hear it's like, when is it? Come on, let's get it going, because if it was already up and running, then we wouldn't have this classroom in quarantine. So I don't know. I mean, we have some potential, maybe, but that's just my concern.
You don't have to be nurse trained to be able to assist with pool testing. So anybody who knows somebody who wants a part-time job, Jen, you got nothing else to do.
Good.
Jump in. Awesome. So I think I appreciate the conversation. It's great. I think we probably should move on.
Yeah, I'm ready. Okay, so we're moving on to new business, and I will entertain a motion to nominate Sarah Hubert as high school guidance counselor.
So moved.
Second, moved and seconded, discussion.
Mark?
Yep, we are happy as a committee to bring Sarah Hubert consideration as school counsel to you. Sarah comes to us with let's try this again. Sarah comes to us with a wide range of experiences in education. Sarah just completed her master's in school counseling at Husson University this spring. As part of that program, she did an internship as school counselor at Monmouth Academy and Wiscasset Middle High School. Prior to that, she has served in the classroom as a math teacher, ELA teacher, and a social studies teacher. Her experiences also include being a dean of students and an assistant principal athletic director. People who have worked with Sarah indicated she is energetic, a go-getter, student-centered, and willing to do what needs to be done.
Thank you. Any questions?
You want to hear from Sarah?
Hi, everybody. Hey. I was thinking of what to say, and really all I want to say is I'm so happy to be here, and I've got some projects in mind. I was talking with Megan today already. So I'm really excited to start talking with kids tomorrow. Mark has been like, hold on, Sarah, hold on. Because I've been over in my office getting it ready and moving my desk around, things like that. So I'm really excited to get started. And like I said, happy to be here.
From my perspective, I would just add one other thing, and I think for me, from my perspective, and I mentioned this to Mr. Campbell, if you only know one thing about Sarah, is she and I served together on, and it's not that she and I served together, that's not it. What's important is that she was on the statewide truancy dropout prevention committee, so that's a legislatively appointed committee. So clearly, if she was choosing or chosen to be on that committee, that's really where her heart is. And so it was my pleasure to work with her for the 2 or 3 years, 4 years, however long we were on it together. So it was great. So I'm very, very excited to have Sarah here.
Anything else? All right, I will call the vote. All those in favor? Vote passes unanimously. Welcome, Sarah.
Welcome.
Thank you.
Thank you.
Thank you. Okay, I will entertain a motion to nominate Widad Titus O'Rourke as high school special education teacher.
So moved.
Second. Moved and seconded. Discussion.
Sue?
Yeah, so our candidate goes by the name of Titus. She comes to us with glowing recommendations. She's currently working as a special education teacher / coordinator in the state of New York. She has moved recently to Maine. Actually, I think it was like 8 years ago, to be honest. And she's planning on coming permanently to Maine because she no longer wants to be in New York. She has a strong skill set. She brings to us working knowledge with transitions, response to intervention, and specialized instruction. I am super excited to have her join us.
Beyond being able to get back out of the classroom, correct?
Beyond being able to return to my office to do what you've hired me to do.
So I also want, just in full disclosure to the school committee, this was a 11th hour working with Sue and this candidate. She's not going to be able to start immediately. First, we talked about postponing this vote until the next meeting, but as I've told you multiple times, it's a 3-step process in hiring staff. Step 1 is to be nominated by me, which is why that's on there. Step 2 is for you to elect, which you hopefully will do in a second. And step 3 is to sign a contract. So I usually don't go to step 3 or go through step 2 unless the candidate is fully aware of kind of what's going on. So Sue was able to reach out to her at basically 5 minutes to 6 to say, would it be okay if we, the school committee elects you tonight, and if for some reason this doesn't happen, you won't sign a contract. And she was very willing to do that. That in essence saves us, if she says yes, and you say yes, and she says yes, will save us 3 weeks, getting here 3 weeks earlier. So I'm glad we're not waiting 3 weeks to consider her candidacy. So hopefully you guys will vote yes, and then hopefully she'll say yes and sign a contract. So I just want to, again, take a second. I know we're talking a lot of stuff, but if we, in the summer, when you give me authority to issue contracts first, then we wouldn't do this. We would go through that process. But I really feel like once school starts, we'll meet on a regular basis, that even though you haven't said this, that permission for me goes away. So this is the way to sort of do this without, and I don't want to issue the contract first.
Okay. Any questions? All right, I'll call the vote. All those in favor? Vote passes unanimously.
Awesome.
Congratulate Titus for us when we talk to her.
Tell her we want her.
Oh, I have.
Okay.
I've already told her, and she has actually turned down a position. She did interview in another district in Maine, and she was very quick to turn them down and said to me she will only be working in Winthrop, as she had a wonderful interview with the team, and she thought the team was very welcoming and warm and a place that she wanted to be. So we had a great committee interview.
I couldn't for that one because I had to meet with you, but I've been on other ones.
It would have been even better.
Yeah.
Okay, are there any other public comments at this time from anybody?
A representative?
Except the nurses.
I know you, but this is a public comment. Is there any public comments you want to add?
No, I think the only public comment that I would add is to say thank you to the members of this board. It's a little bit disheartening that Augusta has sort of hung all of the communities out on their own a little bit and has failed to make any decisive decisions regarding any blanket policies for the whole state, and kind of forcing communities to make it for themselves, which I've seen has sort of driven a wedge between some people and has been rather divisive in others. However, I do think that, as Thomas Jefferson once said, that the government closest to the people is the best form of government, and I applaud you for your service, because there's no doubt in my mind that this board is going to make, and it has made, the best decisions for this community, far better than what we could do at the State House. And so thank you for that. And I know it's not what you signed up for, but your service doesn't go unnoticed. And hang in there, we'll get through it, and you have my support with anything that you guys need.
Thank you.
Thank you very much, and we appreciate your support. All right, we will move on to school committee comments. Jana?
And I know you already said this publicly, but I would like to thank all of the staff that Joel talked about with George and John and Troy, thank you. Seeing some of the projects they got done this summer and knowing all that goes into it. And I know teachers as well, but just an extra thank you to them. And just as these cases climb and Jim sends out his emails, I sense the frustration, and I wish there was a magic wand that we could fix all this and have the answers and have kids and teachers and staff safe in school, but I don't know what answers we're getting, and it's always changing, but thank you for constantly trying to do what's right for kids and in our community. It is appreciated. I feel at my district that we don't even have pool tests. It's almost like night and day. So I'm just very proud of everything that went through. I look at the staff that we've hired to help, and it's amazing. So I just applaud Superintendent Hodgkin for driving that.
Got some positions open, Jenna?
Big pay cut. Huge.
Timothy?
Tomorrow the K-5 kids learning program starts.
Oh, cool.
4 o'clock, if anybody knows kids, we've got 20 signed up.
K-5?
K-5.
Awesome.
And is that
We have
brand
some
new?
5-6-year-olds.
Is that brand new?
It's our second year we started it.
Second.
Do they go on the correct trail?
We do, yeah.
Can you pick up poop on them?
Don't
You give them a little bag for a scavenger hunt? That's for the walk.
I'm sorry, my bad.
Kelly?
I just want to acknowledge how frustrating the beginning of the school year has been for everybody, and scary for sure. I think if administrators and teachers and parents and students aren't pulling their hair out at this point, then they're not paying attention to what's going on, really. And as much as we worry about the kids' mental health, which is a really, really big deal, I think we need to pay extra special attention to the teachers and the administrators' mental health as well, because this is tough. I mean, that's an understatement.
It truly is. Thank you. Joe?
From a historical point of view, my view, This is really one of the better, or certainly the top 10 discussions that the school committee has had. I mean, I served at a time when literally you didn't get all this information, but you certainly didn't get the participation of the audience. You know, I sense, you know, from the heart, the way people are talking, and we're becoming very informed about some of the feelings that are going on out there. And that's important to us as we sit here, particularly those of us that don't have kids in school, to get that kind of information. But my neighbors certainly tell me about what's happening, even some of the neighborhood kids and everything. They're so happy to be back in school, though. They really are. I am kind of shocked to see how many people are now being quarantined. And I think that's a very difficult process, and I think we need to keep working on it. I think the pool testing will help us maybe cut down some of that. Maybe we do need to look at having 4 days in and 1 day to go back to planning and working and giving our staff a little bit more time to prepare some of the things. I'm not saying we have to do it every Wednesday for the rest of the year. I'm just saying that maybe we need to build in some time so that we kind of catch up. But here tonight, we talked about technology. You know, we talked about communication with people. I learned a lot about things that, and I'm sure the administrators learned a lot too, about things that we need to take and prioritize and things that we need to do. But I think the congratulations is really that this is a really good discussion. It's a real open discussion. And you need that more than anything else to get through some of these crises that we have. I'm sure Jim would agree that it's educational to him, it's educational to me, it's educational for all of us. And that's what we need to do is, the more information that we have, the better decisions that we can make too.
Agreed. So I just wanted to say that my daughter and I attended the open house at the high school, and I enjoyed it thoroughly. I got to talk to all the teachers for both my daughters, if you can believe it, and they are just right on top of it. They had syllabus, and they had the plan for if somebody's quarantined. Many of them are doing synchronous learning. I just couldn't believe it, how much they already had in place. The second week of school? I know a lot of them are just continuing on with what they did last year. They just kept their same plan. And so, but it was just really great to be there and to meet them. And I just wanted to say thank you to Mr. Campbell for organizing that, and to all the teachers.
Thank you.
That's all I have. There's no executive session tonight, so I guess without objection, I can declare this meeting adjourned at 8:03. Thank you, everybody. Thank you.